Very good evening to everyone. We are here with yet another virtual session, and today we are here with discussing the virtual or the platform which we have created for all the students. And today we'll explore the journey of Dr. Hemanshu Sharma, who is currently working as a principal at Sant Ridram Medical College of Naturopathy and Yogic Science, Bhopal, Madhya Pradesh. He has done his bachelor's in Naturopathy and Yogic Science from Rajiv Gandhi University of Health Sciences, Bangalore in the 2005. He have completed his master's in public health from London Metropolitan University in 2011. He is having 16 years of experience in the field of yoga and naturopathy, both in clinical and academic part. He is on panel examiner for various universities right now, and he has been personal trainer for ex-defense minister George Fernandes. With this small introduction, sir, I welcome you on our platform, Morning Bro. Thank you so much, sir, to join on us this platform.
Good evening, everyone.
Yes, sir.
Actually, it's nice to be part of this session and sharing your experiences and your journey, career journey, which is still shaping up. It's a quite small career, but there definitely, if somebody can benefit from it, I would love to share that. So I would like Bhavit to ask me whatever you want.
Sure, sir. So we will start the Q&A. It's all about his life, and I know as a student that we can definitely learn from the experiences of Dr. Hemanshu, sir. So my first question, sir, to you: what was the first thought in your mind to choose your career in yoga and naturopathy, as it was not known to the common people at that period of time when you have done your BNYs?
Basically, when I chose to become a doctor, first thing, it was never like yoga and naturopathy as a thing, but definitely yoga being taught to me since childhood. My father has been, I've seen my father practicing yoga throughout his working career. And he is not a medical person. He was just a banker who was practicing yoga every day and who used to make me do yoga in in my vacations as well as in my daily life, and lot many things like in part of yoga he was teaching us and discussing even about Dhiren Brahmachari and Bihar School of Yoga. So that was the influence. But I have to say that when not getting selected in MBBS and then coming, rather than choosing Ayurveda or dental or any other homeopathic course, I prefer to choose yoga and naturopathy because it was again a drugless system. And you know another thing is that most of the diseases were coming from the lifestyle. So that was being when it was taught to me that if somebody wants to stay fit and healthy, they have to be living in a better lifestyle. And that was the reason I chose yoga and naturopathy, and that's how it started off with BNYS.
Okay, sir. So that's a great that we are here from you. So my next question would be to you, sir. What are the different learning phases and approaches to explore more in your college days? Because the 4.5 years of studying in the college is a very long duration to understand and learn, sir.
So actually in BNYS, we have different years, professional years. Like first year was, it was 1 year duration during my time, which is now 1.5 years. So it was that time we used to study the same subjects, but PPY, principle and practice of yoga, was not there. We used to just go for practical yoga class in the morning at 5:30, getting up at 5:30 in Ujire. So at that time, I was wondering why they are asking us, but it was slowly, I was fascinated with the medical subjects like physiology. Basically physiology was one of my favorite subjects in first year, so I used to study on my own apart from the classes. So anatomy was a bit difficult, but when you get I was not knowing whether it is the normal physiology. Physiology was a medical subject, is a normal functioning of the human body, but how it has to be correlated with anatomy and biochemistry, that I was not getting into. But slowly, gradually, when coming to the second year, again I studied pathology. Dr. Prabhu was our teacher, and PSM also was good, community medicine, what I am teaching right now in my college even. So those were the subjects with, like, it's like you slowly, gradually learn over the years. Some of your seniors were telling that you keep on studying, it is good. But how it is going, it is your intellectual journey actually to become a doctor. So this was not taught to me that this is going to help you in this way, or this subject is going to help you in your career at that point. Like, somebody is telling you in your, when you're studying BNYS, that study nutrition now, otherwise you're going to be not prescribing a better diet to a particular person in particular diet. And you should be knowing what does that nutrient do in the biochemistry, because this was learned long after completing my BNYS. When I went to London, I was working with the New Malden Diagnostic Centers in London. So they near Wimbledon it is. So there I was working with the pharmacist, and that person was like, he is a fellow of Royal Pharmacological Society. So he was like, I used to have good interaction with him because he was a Gujarati guy, basically British, but a Gujarati origin. So that guy was asking me, do you know why person eat almonds? And you say that your great grandfathers have been telling that if you eat almonds, neurological functions will improve, memory will improve. So he was the person with whom I used to have interaction. So learning of that biochemistry knowledge, what different nutrients are doing, was applied after around in 2010-11. So I completed my BNYS in 2005. So after 7 years, I was learning that, which I feel that my students or any student should be knowing just after the completion of BNYS. And even the physiology, what the physiological fundamentals I have, that was to be implemented in the time of when we study modern diagnosis as well as the naturopathy diagnosis. So it's like, and even this thing I've come to know right now, even the MBBS fellows, most of the time they will be writing the report, test lab investigations to be completed. But what happened at that time, I realized that, see, earlier there were no diagnostic tools, only inspection, percussion, palpation, and auscultation was there. So those doctors, MBBS doctors, were perfect in that. Even nowadays, the MBBS doctors are not perfect. They are just prescribing the test and getting the report and treating the report. So that was the thing which always motivated, that when that time tests were not there, even people were performing a lot of diagnosis. So a good doctor, that is the part of a naturopath also. They should learn all these things. And to share that, in my third year, my niece, she visited my cousin sister, she visited our hospital, Naturopathy Shantivana. And my niece was diagnosed actually with they were like in Delhi, doctors were not able to diagnose her what is the problem. And all of a sudden, like, that was my first auscultation case, which I did on her. And I found that something is abnormal. So Dr. Murli Krishna was our teacher, who is MBBS doctor, and he's owns a clinic now. I think nursing home in Beltangadi or nearby. So he told me that yes, definitely, and she needs to consult a cardiac surgeon, and it may be a murmur or something. So he told that she should go for complete cardiological test, and then she was diagnosed with rheumatic heart disease. And that is what I feel, that definitely you should have quest to learn each subject, how it is going to contribute. Like, somebody wants to become acupuncturist, definitely what acupuncture does, and what are the cranial nerves, or what are the different nerves which are passing through different channels, and what are their anatomical locations. If they know each and everything about it, I think they will be more, into the subject, and they will be more having command over the practice. That's why each subject to be learned in a special way when you study BNYS. Like similar with the fasting, what I did, I was experiment myself with the fasting therapy. I used to, first year I was a fat guy, and who used to go, like, was all the seniors are telling you should go do fasting, then only you will, like, you will lose weight. So, but I was not knowing anything about fasting, because fasting comes in the third year. So I did fasting on lemon honey water. So it was one thing. And then next year in second year, I again did fasting. And it used to be like I did fasting, and fasting was on jaggery and lemon water. Then it was like after like every Navratri, I used to do that. So that fasting again, after that, it was a, kalpa diet. That is grapes. Black grapes are easily cheaper available. So that was a diet. Then buttermilk fasting also I did. So it was like, different experiments I was doing on myself rather than doing on any patient. So that is the case, you learn from different subjects. It is upon your interest. So that is the case.
Thank you so much, sir, that you have shared your experiences on particular subjects. If I talk about fasting, every student, if they experience this process of fasting, they can imply on their patients too. So there is a question which is arise during your discussion right now. Every student who undergo this different subject learning, they say we do not have a good teacher in our college. We do not have facilities. That is there in every college in some part of subjects in some period of time, but it's their duty to learn more, or how's your point to take on that part?
Definitely on that part, if somebody's students are saying that faculties are not good, I have to say that if you go to the government college in MBBS, if you are supposed to be doing MBBS, I would like to say that if you go there, or any engineering college also, teacher will come and they will take class. Even this is the experience from the London I'm talking about. The class was about 3 hours. One class was for around 3 hours, which is more than a movie. Okay. And here, at least in classroom, somebody is asking you to stay in, but at least in London, they're not asking you to stay in also. You can walk out quietly and you can get in quietly until and unless you're not bothering the lecturer or professor. So in India, it is again, I have to say that they will speak, you have to listen. That is one good thing. And you have books around you. If you don't have books also, there are now e-resources which are easily available. There is YouTube, there is smartphone, there are different apps. Because what your teacher does not know, even YouTube can teach you, Google can teach you. So you can't blame on them then that, okay, definitely when that is a lacuna, because I have been in the academic field for like, professionally as a principal, I am here for around 5.5 years. So if I will take that, nobody approaches with that content in academics also. So if considering that, I think academics is the best part, because they want to learn, but they don't want to contribute to the system. So everybody cannot blame a teacher on that, just that they don't have experience or they're not good, they're not sharing the exact knowledge. You have to be like, you have to be ideal person. You have to show your, at times teacher gets confused, or that, this person may be just asking for buttering to get the good marks in the internals. So that is also there. Sometimes fake questions are being posed. So it depends, either you are right person or asking. And another thing is, if you're good enough and hardworking, you should learn from more books. Because even in MBBS, like in physiology, if you take it, there are around more than 10 or 12 books are there. And what I have studied, around from 5 books, I have referred different chapters. My professor or my teacher did not teach me that you learned this chapter from this book. But I read around 5 books and I came to know this book is good in this chapter, is good in this book, this chapter is good in this book, and how to revise it. I was making my own notes. Nobody was giving notes to us. That is another thing. And I still remember Dr. Shivprasad Shetty used to, dictate, and Dr. Prabhu used to dictate some notes to us. And even after that, I used to feel that it is not good to get the directly writing from the notes. It is always that a student should read from the book, then only, because, something in yoga, we say that knowledge, you have to give a testimonial kind of thing. So what is being taught to you, that has to be there. And definitely that person might have learned from their experience or from the from some book. So you should get access to those books. So I feel that it is not that always the teachers are to be blamed. Yes, definitely at times, if the teachers are to be, those people who blame the teachers, they should come to the academics and contribute to the system.
That is the right thing, sir. You have pointed out here that quest in your learning should be there during your entire academic in BNYS. That would improve your learning phase also. So, what would be the three things which made you different in learning of BNYS?
Things. It was completely a change of personality from being introvert, not outspoken, or not. I'm not outspoken guy, but still. But yes, definitely from introvert to coming to expressing the views, sharing. That was the first thing what I did. It has brought tremendous change. The career has brought tremendous change in my personality. Another thing is three things. It was a practical applicability on your own self, experimenting on yourself rather than doing on your patients or any other human being. Like, if you are making any juice also or cooking something, so how it is going to taste. So these things are there. And again, if you continuously work and study, definitely I have achieved, I was having always a fear of in first year in biochemistry. I never passed my internal assessment exams, and I was in so much fear that I'm going to fail in biochemistry. And I studied it for around a week. Anatomy exam was there. I studied that. After that, physiology exam was there, and physiology 1 and 2. And after that, biochemistry was there. And I was not worried about the PNC at all. And I was continuously studying, and even physiology 2, I was confident that I will pass. And I studied biochemistry in that part also. And I won't boast off, but I scored distinction in the theory just because of that fear. So it is the thing, you have to be consistent. That fear at times also works. So you should be focused what you want to achieve. My focus was just to pass, not to get a distinction. But that fear made me got the distinction. So these three things, that you continuously strive hard and focus it on the thing, then definitely you're going to achieve it.
Thank you so much, sir, saying that if fear is there, positive fear, not the negative
Yes.
fear, positive fear makes us to do right thing. So my next question would be, sir, you have traveled from the north to the south. So there is a process of exploring the diversity in terms of food, in terms of staying with different state people. So what was your personal experience? Can you share with us?
Hostel life was, it is really good. And I lived with almost all the kind of, I was like, most of the times what I feel, people from different states, they limit themselves to those states of people only. I still remember I have friends in Tamil Nadu, I have friends in Kerala, I have friends in, Maharashtra, and almost all the parts of India, like from Manipur also, and like Nepal. And that is the thing, that you get a support from everybody when you interact. It is not, one thing I always found is when you speak the local language, you try to interact in their own language. I was having an interest in speaking. I was influenced by Dr. Anand Bhatt. He was my super senior. He was the guy who used to speak around 10 languages: Malayalam, Tamil, Kannada, and Manipuri also he learned. And Punjabi and Hindi we were speaking, Marathi, and some few words of Gujarati, and Telugu also he was knowing. So I was influenced by him, and you speak all the languages and everybody interacts with you. So that is the one thing I would like to say. That and dietary habits, definitely it was difficult for me. I was not having meals in afternoon. I was my habit was having meals like in the morning, in the evening. So I never used to eat in the afternoon. So that was my buttermilk time. So what I used to do is, after the class in the lunchtime, I used to sleep. I used to take a nap of around half an hour, and I used to again go back to the class. So that was my routine in my college days. And it was wonderful. I think still, I know I have friends in all the states. So, and state here I'm working, maximum number of my batchmates are from Madhya Pradesh, were from Madhya Pradesh. So after Karnataka. So I have to say that Yes, it is a wonderful experience.
Thank you, sir. So there is a process of rotatory internship program in the BNYS for 1 year. So what was the process and mindset you were having to learn?
During our internship, we were posted into different departments like physiotherapy, then treatment sections, then diet section of Shantivana, then even juice section, and it was an internship was quite good. Like you different ward, different we work with different senior doctors around you, and for each different month. But only 1 month posting for this Jindal Institute of Naturopathy and Yogic Sciences, INYS. So there, Bangalore was we were posted for only 1 month over there, and 1 month in TB sanatorium in Baltangadi, near Baltangadi. So that was there, and 1 month at PHC, Primary Health Center in Baltangadi, was we were posted over there. So I learned from the PHC that there were different specialty doctors, like pediatricians were there, obstetricians were. So what I have not learned in our gynecology, that that lady doctor, she helped us out in that part, like doing the delivery even, and a pediatrician taking care of just what is Apgar score and teaching us what to do when the score is going down. So that is something like was helping us. And diagnosis was again like how the MBBS diagnosed the things. And they were telling that it was not basically the test were supposed to be done, it was basically the diagnosis through the normal inspection, palpation, and percussion thing, how you get it. So it was strengthened by it. And it was good experience because even in during my internship, I came in contact with a TCS HR person. She was my patient, and she was telling like I got some guidance from her also regarding that, and she told that don't switch over the jobs for just a couple of thousand of rupees, and don't make your career steps very small, make them big. So when you join a first job, and try to do it for at least 1 year, 2 year, and complete the project at the end, something like what they do. So she was telling that it may not be there in your medical fraternity, but if you're working on something, and try to take as long as steps you can, so that will help you out.
Thank you so much, sir. That one thing I will remember, that do not change your things in 1 month, 2 months. Do not shift your places, jobs, and all, because it makes you irrelevant in the process of learning. So, sir, my next question would be to you: how have you decided your future goals during your BNYs or after completion of your BNYs?
Future goals in BNYS, like it was when I completed of my BNYS, Dr. Sharan, I still remember that Dr. Sharan was speaking on, I was aspirant to becoming SPA director course in America from Arizona State University. And that is what he asked me, what you're going to do. I told, I'm going to do this SPA management because I was one of my friends. Actually, BNYS, how I came to know about BNYS was through my friend who wanted to do BNYS, but he didn't join BNYS. He was my classmate. And Narendra Shetty was Dr. Narendra Shetty is the batchmate of Naveen KV sir. He was working in one hotel, 5-star hotel, that is Park Royal Hotel. And he asked my friend's father to get him admitted in the BNYS course. And this my friend of mine, he asked me to about this course and why don't we both will join. But he didn't join. He joined Ayurveda and I joined BNYS because of inclination. So I wanted to become a SPA director or something in the SPA, but unfortunately I couldn't go. And I entered into a wellness retreat, which is in near Gurugram. And it's after just 6 months of around 9 months of working there, I switched to a completely a hospital setting, that is Krishnadath Health Center. And slowly, gradually, it is like, at such a small salary and getting married at around the age of 26. And again, you have responsibilities coming in. So it's like, the career shaped up according to the financial needs, and then gradually according to your demand, and then what you aspire to become. and that is what it has been now, still running.
So, like how you shaped, sir, that you have told to us that in the process. But
In the
this
process,
MPH, it comes in the 7 years. So how we have thought
yes.
that 7 years?
Actually, I passed out in 2005. Then after in 2006, I was working with this health tech resort in Gurgaon, and I was thinking about, like, how the wellness works. So I couldn't go to America, so to do my spa director course. So I was thinking to work and getting some experience, and then I will go to the some wellness retreat and or some 5-star gym or spa. So I was thinking of going there, but after that I thought that people over there, they don't come for their health benefits, and I am a doctor by profession. They just come for enjoyment and relaxation. They come for just relaxation rather than following. They are suffering from different diseases, but they don't follow the particular specific diets. And the name is health, related to wellness and health. So it was a bit confused. It confused me a bit. So I was thinking, I'm a doctor and who's working in a resort, so it doesn't justify my profession actually. So I came to this Krishna Dutt Health Center. There I started teaching to the diploma students of yoga and naturopathy, as well as I was consulting. And during that consultation, I got Mr. Josh Fernandez as my, I consulted him also. And after that, I became his personal trainer. So the salary was quite meager. You won't imagine, I was working for just 6,000 per month that time in 2006. So, and at that time, it like my financial things were like, I need to earn bit more money. So I was taking consulting the patients outside. So I was doing home consultations. So it started off like that. So gradually, the hospital was not liking that. They asked me to move out. So I moved out. I moved out and I joined a company which was into a corporate yoga session and stress management session, that is T Spiritual Lifestyle Limited, which is a BSc listed company. So they gave me a job, and from there, it was like they permitted me to consult my private consultations also, and which was like a good consultation amount I was charging, and I was financially getting stable on that part. So in 2008, it was the recession which hit again this company. So 7 and 8 I was working over there, and sorry, 2008 complete and 9. It was just that time the recession repercussions were there, and I, like, what the students now they are facing in corona times. That thing I faced in 2008. And corporates, they were not conducting any yoga sessions. I took yoga sessions for around I have to say roughly around 42 multinational companies like Sony India, Convergys, WNS, Acme Telepower, PepsiCo, then SpiceJet, and lot Indian Air Force, and some more are there. Like, I was supposed to go to even Jim Corbett for that, and like destination spa sessions were also taken for them. So, like, for Air Force in different areas. And that is what I was doing in TCS. I was taking around, like, in Gurgaon there are around 7 TCS offices are there. So I was taking yoga sessions on each day in each office. And I was uh, making them learn the consultation, and as well as I was making them do the chair yoga, what they can do. And like I was like a wellness coach for them. So that was my part. And again, that after the recession, my personal consultation and personal yoga classes were continuing apart from that. And those classes were like, it was completely not just a consultation. It was like managing the person's, like, the VIP, I have to say, that industrialist, those who are like, they want to manage their health profile through alternative system. So that was my first interaction with, even in 2000, after coming back, in 2009, this thing has been continued. And I joined Morarji Desai National Institute of Yoga, and that was a contractual job. So I was started working at around 12,500 at Morarji Desai National Institute of Yoga. And I was working in this TB hospital, which is now LRS TB hospital, which is now National Institute of Tuberculosis and Respiratory Disease, Mehrauli, just next to Qutub Minar. So there I was working, and I was doing the consultations, and I was working with the senior chest physician, Dr. Puri, and even helped the DNB students in respiratory medicine to generate a protocol for COPD. And that was my contribution there. And making the poor people. And I took couple of sessions of yoga from the Mississippi School of Public Health. So I got introduced to public health at that time. And those people are telling you can do miracles, because lot many things like communicable disease are there in developing countries, but non-communicable disease are more in the, even in developing country as well as in abroad, US and UK. People are suffering from non-communicable disease, and there you can help them out, and you can plan out research on something. But it was a respiratory disease, so it was a communicable disease, mostly tuberculosis, and again, like different other diseases people were coming. So that was the case, and came to know about public health, and I was thinking that why not? Because MBBS people, they're least interested in making the policies about you more, or contributing more to they can least contribute to the non-communicable disease actually, which is around 64% of the burden of there is in disease. If you take it out, there is a 64% burden is from non-communicable disease, and MBBS people cannot do anything. They can just work on the communicable disease. So that was the part where, you an Ayush system person can easily, and especially yoga and naturopathy person, can do miracles, as because you correct the person's lifestyle and behavior, and once that is corrected, automatically things come on track. So that is what we can do, and that is how I went and did MPH from abroad, because in India, NICD, National Institute of Communicable Disease, was not permitting Ayush persons to do MPH. That was the case. That time IAPH was not there. Indian Institute of Public Health was not there. So it was like I went abroad, I spent money, and coming back again, hardly, in India, the scenario is that you just get around 80-90% in MPH also. So I went for an interview at ICMR. After coming from there, I wanted to join ICMR, and because of my percentage, I was rejected, saying that I scored hardly 59% in my MPH, and there were people who scored around 80%, 75%. So I was surprised to see that even nobody scored in a BNYS. Nobody used to score at that time in BNYS also. So I was thinking that I'm quite odd one out. So, but I didn't join. I didn't join ICMR. I joined back MDNY, and I was working with again different CGHS dispensaries, and working with around 7. I was handling around 10 dispensaries, and in around Delhi. So visiting them, and after that, when I joined the college, I gave interviews, and I lot of interviews, and I got also into the WHO project coordinator at MDNY, but I joined Sant Tirtharam Medical College of Naturopathy and Yoga Sciences as principal, and that is how the teaching was my passion. I was teaching in MDNY, also in Krishnadat Health Center also I was teaching. So teaching was continuous, and apart from that, it's like aspirant. Like I was in college days also, I used to go for gym. It is not only that you have to just perform yoga. So I was doing gym also. So I was knowing applied aspect of exercise therapy. I did from a course I used to teach for American Council of Exercise, that is ACE, and ISA, Indian Sports Science Association from America. So I was teaching those students also. So that is how I learned the applied aspect, depending upon the problem, how you design exercise of the weights, without weights, isometric exercise, and it is like isotonic exercise. So that was the thing which made me learn all these things about, and even the biochemistry value. Again, it is like what are the natural steroids, what are the effect of supplements in the different bodybuilding and all they do. So steroids, so all these things motivate, because when we were studying there was no pharmacology was not subject of BNYS. So out of that proportion I studied again, like being in the allopathy hospital, so drugs were given. So out of interest, out of quest, I learned the pharmacological aspect also, as well as keeping eye on the career. So that is how it shaped up.
So it's great. I must say there are a few points I have noted it, that how the journey you have shaped, it was not decided by you, but it made you to decide to do in the same way how you have done. Sir, as you are principal of esteemed institute, so what are the different changes you want to bring in the process of BNYS?
BNYS, I don't want to bring anything like what I did was, after coming in Madhya Pradesh, what we started off first thing was to dovetail. Like, when a BNYS student studies, we were not teaching pharmacology here when I joined. So we included forensic also and pharmacology also into the curriculum of BNYS in Madhya Pradesh. So because what I felt is there is a need for it, because patients, they don't come as first hand to us. They come always like last stand. Actually, we are the last option when they're going to die, or they feel that they have been, like failed by all the systems of medicine. They come to us and they say that kindly help us out. And they must be taking some Ayurvedic medicine, some allopathic medicine. So at least we should know what to remove and when to remove, or how to taper it down. So that is required. Another thing is from the forensic part. See, always there is physiology you learn, and from physiology, learn the abnormal physiology, that is pathology. And in that, if there is any, jurisprediction part is there, then you learn the forensic. So these things are required, and BNYS curriculum has to be planned like that. So for 1.5 hours is quite extensive. So we should do that. And there's a lack of resources in naturopathy diagnosis. I feel that when I was learning it, there were not many resources were there, like online internet, that those things were not there. Right now it is there, and students, they want, like they should take more interest to develop the system. And they should even, because students say that when they are learning, they say that teachers are not teaching us properly, or teachers are not experienced. Definitely they are not, because system is hardly 30 years old, and everybody doesn't come to the academics. The formal education of BNYS started just 30 years ago. So these are the things which is required always, and which comes with the experience. And again, the thing, when they pass out, they want salary which is to be around 30,000, 40,000, 50,000, or even more than that. And if you go to the cruise, they are earning in dollars. And that is the case. So who will come and teach? And these are the things, like, students, they definitely, you have a short-term goal and long-term goal, what you want to achieve. So it should be the change that BNYS doctors should always share the knowledge. And once somebody is having something, they will not share it with the other person. That is how in last conference in our, which we conducted this year, online conference, we shared that there should be a faculty exchange program, so that from the seniors, from the newcomer also should learn what they have to teach, what new methods are there, what are the resources they can explore. That is that these are the changes to be included. And one more thing, that we BNYS doctors always think that we perform yoga very well. We don't compare it, because we don't see around what is happening in MSc or yoga, or BSc yoga. And as I have taught to in students in diploma students in MDNY, and even certificate course students in MDNY, and BSc students in MDNY, those students, they have a fear factor that if they will not perform yoga, they will not be asked anywhere, because they are not having that much knowledge of medical subjects. So they have only one thing, that is yoga. Perform yoga well, and their career will flourish like anything. Somebody from, doctors, BNYS doctors will only hire them. But we BNYS don't think about that at all. Why can't we go to ICCR interview and go abroad, when those people who are doing diploma, they can go, or some BSc yoga fellow can go? We people don't train ourselves in that way. So yoga aspirants also, they will be practicing yoga in their BNYS curriculum schedule very well, but just after passing out, in the coming to the internship only, we stop doing yoga, and our flexibility start losing. We don't practice it every day, so automatically we lose to yoga professionals like MSc yoga, BSc yoga, or diploma yoga, and they will be going to the ICCR, which is a very good job. It's a 2-year government of India contract where you earn approximately somewhere around $1,500 to $2,000 per month, apart from your yoga instructor salary. So which is contributing to somewhere around 2 lakh rupees per month. So which is a very good amount, I feel, in the beginning of a career, or if you take 3 years experience also, because by the end of 3 years after BNYS, like me, somebody will be having a belly. So, or the girls who are practicing yoga, they will be delivering the children. So there is no BNYS career. A student should focus what they want to achieve. Okay. Bhavit?
Yes, sir. Sorry, sir. It was on mute. So in this informative era, how a BNY student should bring changes in the process of working or learning?
See, working there, you have to be very much, aware about the software. Like, you can't say that I don't know anything about computers. BNYS doctors in abroad, you go to UK, America, all the doctors, they're aware. They don't know about the CPU and all, but at least they know how to type, how to get the electronic data generated. Okay, patient's data, patient's file, how to keep their medical records electronically, and what is the confidentiality ethics thing. So these things are to be learned by the students, and because that is the first thing what we will do is testimonial. In in naturopathy, we always go for testimonial is the last thing actually. If you take the research things, these are the, when you can't do a proper research, a clinician can show a testimonial, that is fine, even without mentioning the name of the person. And even in BNYS, I have seen that they will tell this, but this is the name of the person, he is this many year old and he is from this place and he came visited our hospital, he is suffering from this problem and he got cured of it. So that is the death of a medical ethics. Directly you have declared that this person has come, and you have declared it on like testimonial and published on a pamphlet or a booklet, which is going to be kept in the advertisement, or so that should not be there. So that is the first thing. And another thing I want to say is you should always when if you, in the case you think of I have to say, it is something like you should always behave in a particular manner, protocol, like when you did treatments in the part, you should know what treatment you're giving for what purpose, and you should not be like over prescribing the treatments. Okay, this person has come to the hospital. Nowadays patients are coming that they're asking, okay, you kindly prescribe me this. So at least being a doctor, you should tell them what to do and why this treatment is going to help. You have to give counseling also to them. Your psychological counseling will be a bit helpful, why you are giving this treatment, how it is going to be helpful, and side by side you should be taking the notes also. So these things are very important, being a professional part, I feel.
Sure, sir. That would be there to learn for every student. And with your entire journey, sir, with full of different taste of experiences, what would be the parting thought to all the students and doctors who are going to watch this?
Get you who are
So, like with your entire journey with full of different experiences, what would be your parting thoughts or the ending thoughts to all the students who are watching this or the doctors who are watching this?
Yeah, for them, I have to say that, see, you can't replicate a journey. I feel that from, like, if my journey is, if you take, I have seen lot many doctors when Dr. Naveen KV used to come for as our external examiner, and it was different scenario. So I was not copying. Even Dr. Naren Shetty, I was knowing about him, but I was not copying him. So you have to pave the way for yourself if you are having sufficient skill. If your skill is not a BNYS degree, BNYS degree is not skill. It is your degree. Skill is, I'm good at acupuncture needling. These many patients I have given acupuncture. Skill is, I'm good at manipulative therapy. I'm good at it. I can perform that. I'm good at performing yoga. I can teach Jalneti to this person easily. I can perform this much asanas. That is the skill. Okay. So degree is for your professional conduct. So what you're good at it, perform it. Somebody can be a, like, nutrition, they may be good in performing different, cooking different recipes through naturopathy. So that is their skill. So I have to say that don't copy somebody, pave way for yourself. Different aspects are coming up, like, scopes are there. Somebody may be going in cruise, somebody maybe, you can get financially stable and then you can perform, or you can be an entrepreneur and start doing the thing like what you want to achieve. Basically, it is something like, at times at the end of the career also, people, they don't know what they're going to do. So that is the main drawback. If you don't know that, definitely you need to think a lot. So if you're good, so because you are becoming a doctor as a BNYS. So in which field you want to go? You want to go into wellness, you want to go into academics, you want to go into clinical side. You should be knowing what you're going to do and how to approach, what skill sets you need. If you're going to become a wellness coach, definitely you need to have good English. You need to have good command over, like, exercise routines. I have seen in my career, I have seen different people who are there, like, who are busy, who promised me 20 days of their, like, 20 days in a month, they were like doing who are going to do yoga with me. But when they couldn't give time to me, big industrialists were there. So they couldn't, they couldn't, because 20 days they will be abroad, staying abroad. So it is very difficult to get the target achieved in 10 days. So I was making them work for more than 1.5 hours and follow the diet strictly. So that was like, where you have to be, you should know what you are doing and how to get the things done, like, achieve this, even the targets, or you can say proper profile, or you can say at least functioning with them, like, their lipid profile or something like biochemical tests. So those things should come in time. So these things were like, you have to make a protocol in such a way. So it comes with the experience, and each time you experiment, not experiment, I have to say, it practice with those certain changes in the protocol. So these things should be there, and don't copy anybody, don't envy anybody. Rather than, you just simply ask somebody by how you learned it. Like, every time I try to learn from different things from different people. They may be not doctors, they may not be, but something is productive. Definitely, I have to be acceptable to the knowledge being shared by anybody. What you can learn from somebody, you should, even from Ayurveda fellow, from MBBS fellow, from homeopath. Like I will always say that you can learn case history taking from homeopaths. It is one of the most detailed case history. Okay, that you can do. From allopaths, you can learn, traditional allopaths, you can learn how to get the diagnosis, like, how to do modern diagnosis, like what we do, facial diagnosis and all, iris diagnosis. Even lot many things are to be learned from allopaths, and lot many things are to be learned from Ayurveda person also. So these things you should know. Okay, that is the way I can say. Always be a learner throughout, because you are in a profession which is going to have new updates every day, and it is going to keep on, it is going to come up every day. Medical science is changing. Okay, so be a learner always.
Thank you so much, sir, that you have shared or shaped this session from beginning of your BNOS to current what you're doing. And I wanted to share that how I met with sir and how I called him that today, sir, we can discuss. So there was a time in 2016 July when we met in a bus, traveling in a bus, and he talked me for the 30 minutes. on standing, we were both standing in front of each other, and he discussed entire my journey, that how I joined BNYS and what was my purpose. And he shaped in the 7 days program what we have attended. He shaped me in that 7 days. And when he left that place, he told me one thing I still remember, that do whatever you are doing, but do have a goal that after 5 years, what you want to do. That was my first year. And right now I have finished my BNY. So these are the changes you will learn every day from different doctors. And with this session, sir, I have pointed out 3 things. Quest in your learning, have a positive fear to reach your goal, and being acceptable and learn with every person to whom we are meeting every day. So with these 3 things, I must say thanks to you, a very big thank that you have come to our platform and shared very detailed way of the journey to learn by a student. Thank you so much, sir.
Thank you. Thank you, Pavit, for inviting me. And hope this will help different students to shape up their own career and journeys in after BNYS, and even how to study during BNYS. Thanks a lot.
Thank you, sir. Namaste, sir.
Namaskar.